Hi there, my name is Dr. Walt Hadikin. I'm the Director of Clinical Content and Communications at Epocrates. Today we're going to take a look at Epocrates Plus on mobile. With E Plus, you get rapid answers to clinical questions, not only related to drugs, but also diseases, infections, lab tests, herbs and supplements, and more. Designed by clinicians, the content is formatted for use in a busy clinic setting, right in front of patients. In fact, recommendations are bundled by specific patient characteristics whenever possible, allowing for clinical decision support tailored to the patient in your exam room now. So let's walk through a few examples of how E Plus supports clinical decisions, starting with diseases. So let's imagine we're in clinic and we need some support managing a patient with suspected COPD. Now here on the reference page of the app, let's tap into the diseases section here in the center of the screen. Typing COPD will then take us to the COPD disease topic with its 5 quick reference sections displayed right up front. A high-level overview of the condition, highlights and basics, is on top, followed by 4 sections arranged in order of workflow during a typical office visit. So firstly, under history and exam, we'll find a list of risk factors and key diagnostic findings. Tapping into any item, such as cough, shows a brief description of that finding specific for COPD. Next, we see tests. Tapping on any test, for example, spirometry at the top, will show results that support a diagnosis of COPD. Now, before we're ready to jump into treatment, a differential diagnosis section lists other conditions to consider in a patient suspected of having COPD. Tapping into any differential will show a brief description of that condition, for example, asthma here, with a link to its own full disease topic at the bottom. But let's say we're pretty confident in our diagnosis of COPD in this patient, and we're ready to move on to treatment. Under treatment options, we're going to see that patient-centric stratification that I mentioned earlier. Let's tap into Gold Group B, Initial Treatment, to see first and second line treatment options listed for our patient. Tapping at the very top into LABA/LAMA, we'll see various long-acting beta agonist and muscarinic antagonist combos. Tapping on any drug name will take us instantly to the Epocrates drug information for that product, with all of its sections listed, including formulary information always in view right here near the top, allowing informed treatment decisions to optimize drug affordability. Now, before we leave the COPD topic, we can save it for later by tapping the bookmark icon at the top right for even quicker access later. Let's go back to the home screen. Next, let's say a patient asks you about berberine for weight loss. She tells you that she read an article recently where berberine was called nature's Ozempic, and she wants to give it a try for weight management. Now, to help advise her on the safe use of this alternative therapy, we turn to E+. Now, since this isn't the first patient who's asked me about berberine recently, I've already saved this topic, so I can go to my saved list in the thumb navigation bar, and at the bottom right, I see saved, and I'll tap in there. And lo and behold, we see that COPD topic at the very top, the one that I just saved. And right below that is berberine. Tapping berberine will then take me to the berberine herb and supplement information, with sections including reported uses, of which in this case there are many, reported doses for those various uses, cautions, and adverse reactions to help us counsel our patient. Now, since our patient is also taking warfarin, we can perform a quick interaction check by tapping drug interactions, which allows us to add berberine directly to the interaction checker. And then we'll add warfarin. We'll tap confirm drug list and view potential interactions. And quickly we see there's a potential interaction. Due to the possibility for liver metabolism inhibition, the combo can actually increase warfarin levels, so we're going to want to closely monitor INR and warn our patient about the potential for bleeding if she decides to move ahead with berberine. So shifting gears a little now, let's imagine we're working an urgent care shift and we're attending a patient who's been bitten by a cat. Now, in this case, we're not going to need support on things like tests to order or differential diagnosis, but instead we're just looking for the latest antibiotic recommendations. So for this, let's use ID treatment selector to find the answer. So again, here from the reference page, let's tap on the Petri dish icon at the right side of the screen. Now, from the body systems list on the landing page, let's tap into skin soft tissue, then bites, and then cat. That will take us to the empiric therapy page for cat bites in adults, where we can see first, second, and third line antimicrobial options. And just like with diseases, tapping on any drug name will take us to the Epocrates drug information for that product. And at the bottom of the screen, the thumb navigation buttons allow us to toggle over to a specific therapy page in case we need support managing a specific pathogen, and other information where we can find some additional details on cat bites. Going back to the home screen again, finally, for those times when an abnormal lab test comes back and the reason behind it isn't immediately obvious, the ePlus Labs reference comes in very handy. Imagine, say, a routine CBC shows an isolated elevation of MCV, the mean corpuscular volume. So here, right in the search bar at the top, we can type in MCV, and then we can see that there's a lab test for MCV with some brief information on top. And under lab result, we tap high to see a list of possible causes and contributing factors for a high MCV, arranged by conditions, drugs, and spurious causes. Oops. Going back to conditions, tapping into any of those, for example, myelodysplasia in this case, shows recommended follow-up labs for that suspected cause, and also a link to the disease topic for that particular cause, in this case, myelodysplastic syndrome, where again, we see those familiar quick reference sections displayed right up front for easy navigation. So that concludes our tour of the Epocrates Plus features. But remember, with ePlus, you also have one-stop access to Epocrates drugs, more than 600 calculators and risk scores, more than 150 titles in our guidelines library, which is also organized by specific patient type, pill ID, and last but not least, bugs and drugs, a unique tool for determining outpatient infection trends and susceptibility patterns in communities based on zip code. So remember to check out ePlus on iOS, Android, or web. Thank you.